Hi YouTube family, welcome to Concept in Medicine. In today's tutorial we are going to be looking at classification of antibiotics, a very simple approach to understanding how antibiotics are classified, the examples under each class, and also the mechanism of action and the indication. So let's begin. So the first thing I want you to know for the antibiotics classification is that we are going to be looking at 10 classes. 10 classes. There are more than that, but we are going to be looking at 10 classes today. In subsequent videos, we'll zoom in on other classes. So the 10 classes, to easily remember them, I've generated an acronym that would help you to easily and quickly remember the 10 classes. And what is this acronym? So remember, SMART for processes like Golgi. SMART. Our SMART has 2 C's, not R. So the R is replaced by what? 2 C's. So what do each of these letters stand for? So the SMART we are looking at, all these are antibiotic classes. The 4, only the F is a class. The P, L, G. So what are they? So the first one we have the sulfonamides. The second one, macrolides. The next one, aminoglycosides. The C, cephalosporins. Another C, carbapenems. The T, tetracyclines. Go for 4. That's the fluoroquinolones. Then we have processes. That's the P. We have the penicillins. We have the L for like Lincolsamides. Then finally the Golgi. That's the G, glycopeptides. Interesting, right? Okay. So the next thing we'll be doing is to zoom in on each and every class. So we are going to start with the first class, that's the sulfonamides. The first thing we want to look at there is the examples. So what are the examples? We have the sulfasalazine, sulfadazine, and very common is the trimethoprim sulfamethoxazole. I mean, we are looking at the sulfamethoxazole component especially. All right. So the next thing we want to talk about is the mechanism of action. What are the sulfonamides indicated for? A simple trick is that look at the FO in the sulfonamide. It goes with folic acid. So in that case, we'll say that the sulfonamide inhibits folic acid synthesis. Interesting, right? Yes. Now let's move ahead and look at the indications. What are they indicated for? Yes, they are indicated for treating gram-positive and gram-negative bacteria. And what are some of these conditions? We are looking at burns. Remember burns, right? The wound care. We use the silver sulfadiazine cream for exposure method, and it can even be used for the close method. Remember, right? Okay, let's move on. The next one is the eye infections, and finally UTIs. So that's the first class of antibiotics. The examples, the mechanism of action, the indication. The next one we want to look at is the macrolides. The examples, we can think of azithromycin, erythromycin, and what? Clarithromycin. Then, mechanism of action, we should remember that they inhibit protein synthesis by binding to the 50S subunits, which are found where? On the ribosome. So when they bind to that, they inhibit what? Protein synthesis. So that will be the mechanism of action for the macrolides. They are indicated for treating only the gram-positive bacteria. When we are done, I'll show you a trick to remember which ones go for gram-positive, which one goes for both, and which one goes for gram-negative. And also another trick for the mechanism of action. Okay, the indications we said for gram-positive. And which conditions are we looking at there? We can think of atypical pneumonia, amikacin. We can also think of neomycin, gentamicin, and finally kanamycin. Ear, nose, and throat infections, sinusitis, sexually transmitted diseases, and gastrointestinal tract infections. The next class is the aminoglycosides. And the examples, we can think of the tobramycin, we can think of the streptomycin, we can think of what? Another one. What's the mechanism of action? Simply put, they inhibit protein synthesis by binding to the 30S subunit. What are the indications? For the aminoglycosides, they are only good for treating what? gram-negative. Mostly they are used for what? Treating gram-negative bacteria. And what are some of the conditions we can think of? Yes, we can think of the septicemia and abdominal infections. The next class is the carbapenems. For the carbapenems, the examples, they will end with what? Enems. For the carbapenems, we can think of the imipenem, meropenem, and ectapenem. Now, their mechanism of action is simply they inhibit cell wall synthesis by binding to the penicillin binding protein. And what does the penicillin binding protein do? They polymerize and modify the peptidoglycan in the cellular wall. I hope that makes sense to you. Okay, for their indication, they can be used for both gram-positive and gram-negative. And what are some of the conditions they can be used for? Pneumonia, urinary tract infections, and what? Abdominal infections. The next class is the cephalosporins. For the cephalosporins, the examples, they have about 5 generations. Some school of thought have it to be 6, but we'll look at the 5 generation and some examples. So the first generation, we can think of cefazolin, cefalexin. The second generation, cefuroxime, cefotetan. The third generation, very common, ceftriaxone, cefixime, cefotaxime, ceftaxidim, cefpodoxime. Those are some of the examples of the third generation. For the fourth generation, we are thinking of cefipime or cefipime. Then the fifth generation, ceftaroline. Mechanism of action, they inhibit cell wall synthesis. And what are some of the indications that can be used to treat both gram-negative and gram-positive bacteria? Then, what are some of the conditions? We can think of pneumonia, that's respiratory infections, skin infections, and urinary tract infections. The next class, the tetracyclines. Very common examples. We have the tetracycline itself and doxycycline. And what do? Simply, yes, they will be what? Inhibiting protein synthesis by binding to the 30X subunit. And what are some of the examples? What are some of the conditions that they can be used for? Of course, pelvic inflammatory diseases. We can think of what? Atypical pneumonia, sexually transmitted diseases, and finally, Lyme disease. So let's look at the seventh one. The seventh one, the fluoroquinolones. You see, the examples, we can think of ciprofloxacin, ofloxacin, norfloxacin, levofloxacin. The mechanism of action is very simple. Look at it. Fluoroquine, quintuples, meaning that multiples. And if you are looking at multiples, what are you looking at? Replication. And where can we have the replication? DNA. So we will say that, simply put, the fluoroquinolones, the mechanism of action, they inhibit DNA synthesis or DNA replication. And for the indications, they can be used for both gram-positive and gram-negative. And what are some of these conditions? We are talking about respiratory infections such as pneumonia, talking about gastrointestinal tract infections and urinary tract infections. The next one is the penicillins. What are the examples? Penicillin G. We can even think of penicillin V, aqueous penicillin, crystalline penicillin, benzactine penicillin, ampicillin, amoxicillin. Then we can move to the penicillinase resistance. They release what? Penicillinase, which breaks down the penicillin activity. So because of that, some penicillin have what? That added penicillinase activity. What are those antibiotics? So for the penicillinase resistance, we can think of what? Clozacillin. We can also think of oxacillin, methicillin, dicloxacillin. Then the next one is the antisedemonal penicillins. For that, we can think of carbapenicillin, ticagrelin, piperacillin. Then the mechanism of action, what do? They inhibit cell wall synthesis. And the indication, they are indicated for both gram-positive and gram-negative. And what are some of the conditions? You can think of respiratory infections such as pneumonia. You can think of urinary tract infection and ear, nose, and throat infections. The next class is the lincolsamide. For the lincolsamide examples, we can have clindamycin and what? Lincomycin. For the mechanism of action, what do? They inhibit protein synthesis by binding to the 50X. By binding to the 50S subunit, thereby what? Inhibiting the synthesis of what? Protein. The indication, they are only indicated for gram-positive bacteria. And what are some of these conditions? We can think of pneumonia, skin infections, and bone infections. Then finally, we have the glycopeptides. The single example, even though there are other examples, but the most common example, as you know, glycopeptides, we are talking about vancomycin. Vancomycin, you should remember that anytime the Staphylococcus aureus has that methicillin resistant activity, the drug of choice to go for is what? Vancomycin. So for the vancomycin, what's the indication of, for the vancomycin, what is the mechanism of action? It inhibits cell wall synthesis. And what the indication is, what do they go for? Only gram-positive bacteria. And what are some of these conditions? We can think of endocarditis, skin infections, and finally, as we said before, methicillin-resistant Staphylococcus aureus infections. So those are the classes of antibiotics, their examples, the mechanism of action, and some of the indications. Then finally, the final trick before we close the topic is this. If you are looking at antibiotic classes with only singular activity with respect to the gram-positive or gram-negative, means that they act against only one bacteria, that is, they act either against gram-negative or against gram-positive. You can use the acronym GAM. And for the GAM, only A will be what? Negative. So meaning that the glycopeptides, they would act against gram-positive, only gram-positive bacteria. But the aminoglycoside, which is the gentamicin example, would act against only gram-negative. Then the lincosamides, an example, clindamycin, would act against only gram-positive. And finally, the macrolides. The macrolides, which, an example, we are looking at erythromycin, azithromycin, and so forth and so on, they will only act against gram-positive bacteria. And finally, another technique here is that you can use the acronym MALT, which is found in a lot of proteinaceous substances. MALT meaning protein synthesis. MALT meaning that you are looking at M for macrolides, the mechanism of action, inhibit protein synthesis, the aminoglycosides. What do they also do? They inhibit protein synthesis. The lincolsamide, what do they also do? They inhibit protein synthesis. And finally, the tetracyclines, they also inhibit protein synthesis. So to remember which classes of antibiotics inhibit protein synthesis, remember MALT. That is macrolides, aminoglycoside, lincosamides, and tetracycline. And another trick here is that for those that inhibit 30S, remember AT meaning aminoglycosides and tetracycline, they will be for 30. The macrolides and the lincosamide, they will go for 50S. And finally, as I already explained with regards to the fluoroquinolones, the queen in fluoroquinolones goes for quintuple, meaning multiples. And if you are looking at multiples, they are looking at what? Replication. So we are saying the fluoroquinolones, they inhibit DNA replication. They inhibit DNA synthesis. Thank you very much for staying through this lesson. I believe you enjoyed this session, this particular session, and I believe it will go a long way to stamp an authority in antibiotics classification for you. Kindly make sure to subscribe, like, share, and also comment the next concept you would like to see in my next video. My name is Dr. Del, and this is Concept in Medicine. Bye-bye.